If you clicked on this video, you probably just had a baby. So first off, congratulations. So your baby's just arrived and you might feel like your body is a disaster right now, but don't worry, it will get better. In this video, I'm going to talk about how to recover from a baby delivery, common problems you might encounter, and what to do about them. But first, welcome to Dianainthepink. My name is Diana. I'm a physician assistant. I specialize in women's health and gynecology. You are watching In the Pink, and if you're new here, In the Pink means in good health and spirit. So if you like being healthy and happy, click subscribe because you are in the right place. In this video, I'm going to be talking about bleeding, C-section stitches, vulvar stitches, breastfeeding, your first bowel movements, and postpartum depression. And at the end, I'll be talking about warning signs to watch for that could be a symptom that something serious is going on. So make sure to stick around for that. So first off, bleeding. You are going to be bleeding heavily for a week or two, but it is going to gradually taper off. So let's talk more about that. Postpartum bleeding is called lochia, and it's mostly blood mixed with fluids and endometrial tissue. It starts off dark red and then fades to pinkish brown and then finally whitish yellow, and then it stops. While you're in the hospital, I recommend that you wear baggy clothing, especially in the first 24 to 48 hours. Your nurses are going to be checking your bleeding and your stitches quite often, and you want them to be able to see easily down there. So wear really baggy sweatpants or jammies, and if you had a C-section like I did, they will also be checking your incision a lot. So honestly, you can just chill in their hospital gowns. That's what I did for the first few days. That way you won't have to worry about getting blood on them. The nurses can check whatever they need to check on. Everyone is happy. Now your nurse is gonna give you these one-size-fits-all mesh underwear. And they look ridiculous, but you are going to love them because you're not going to care if they get blood on them, which you will, and they are really stretchy and they hold large pads, which they also give you at the hospital. Now the day that you deliver your baby and then the next day, just put 2 pads in there. You're gonna be bleeding a lot, like a really heavy flow. Even if you delivered C-section, you'll avoid more overflow messes if you just wear 2 of them at first. And as a side note, whatever is in your hospital room is yours to take. I mean, not like the lamps and the chairs, but whatever is stocked in the bathroom, it's yours. So take all the mesh undies, take all the pads, the diapers for your babies, the wipes, they're all yours. You've paid for them. So make sure to take them before you go home. Once you get home, you need to continue to watch how much you are bleeding. Depending on your activity for the day, some days may be a little bit heavier, some days may be a little bit lighter, but overall, they should be getting lighter and lighter. And you should never be filling a pad faster than every hour. And if that happens, call your OB. At home, you want to make sure to have all of the pads and the supplies that you need. So I recommend heavy flow pads. Pick the ones with the wings on them if they're available. That helps to prevent leaks. Get overnight pads. You could also consider it a postpartum pad or an incontinence pad to go on your bed for the first few weeks, so that if you do have overflow bleeding throughout the night, you won't stain your sheets. Or you could just make sure you have a mattress protector. That works too. You should not be using tampons or cups or any other products that go inside your vagina. Nothing should go inside your vagina. A good rule of thumb is for 6 weeks. Could be sooner, but only if your OB or midwife has examined you and makes sure that everything is okay before you do. The reason is your vagina has just gone through a lot, and having what we call pelvic rest is really important for you to heal. You also don't want to be using products that block the flow of blood from coming out. You want that blood, or lochia, to come out freely. So pelvic rest for 6 weeks or when your OB gives you the okay. Let's move on and talk about your healing down there. So to avoid any confusion, when I'm talking about the external genitalia, I'm referring to the vulva. Now the inside where a tampon goes, that's called the vagina. Whether you tore, if you have stitches down there or not, the vulva is remarkably good at healing. But there are a few things that you can do to help the healing process be more comfortable. So first off, the vulva will be really sensitive at first, and sometimes when urine touches it, that can cause some burning. Now at the hospital, they usually give you a squeezable plastic bottle called a peri bottle, and this becomes your best friend, especially at first. So fill that bottle with warm water. I preferred warm water. You can use cool if you like that. When you sit down to urinate, you spray that bottle right on your urethral opening. This helps to dilute the urine, and it helps to prevent it from burning. You can also squeeze it all over the vulva to help clean off any blood that you have or urine down there, because you want to keep your vulva as clean as possible. And also wiping it with toilet paper can be uncomfortable, especially if you have stitches. So spraying it with warm or cool water to rinse off the blood and the urine and then just pat dry it with a clean cloth. You can use toilet paper to pat dry it. Just wrap the paper around your hands. I think that's a little bit better than crumpled toilet paper, which is more likely to like leave little bits of wet toilet paper behind. A few things that you can do to soothe the achiness. You can take sitz baths. You can either do this in your bathtub or you can buy little basins that go over your toilet. Both work just fine. You want to fill the bathtub or the basin with a few inches of hot water. Not hot enough to burn you, but warmer than lukewarm. I usually recommend adding some Epsom salt to the baths. It's really, really soothing. Another thing you can do is pick up a topical numbing spray. They contain a similar ingredient with what they use when they numb you up before you get stitches. It's called benzocaine, and it has some nice numbing action that can give you some pain relief as well. You can also pick up postpartum reusable cold packs. They're in the shape of a pad, and you can throw them in the freezer or also the microwave, whichever feels the best for you. And then you can put it down there under your underwear. It doesn't absorb blood, so be aware of that, but it's really soothing. Overall, you don't need antibiotic ointments, you don't need band-aids. If you had stitches, they will be absorbable. You won't have to go and have the stitches removed. If you had a C-section, those stitches are usually absorbable too. The exception is if you had staples or if your OB says otherwise. Now, for some women, constipation can be an issue, especially if you were given pain medications that are stronger than like ibuprofen or naproxen. Pain meds can cause constipation. Also, iron from your prenatal vitamins can cause constipation, which, by the way, you should still be taking your prenatals. So if you aren't having a bowel movement as often as you normally do, or if your poop is much harder or you have to really strain to get things to come out, you might want to consider asking your OB if you can take a stool softener like Colace. One common problem of both constipation and delivering a baby is hemorrhoids. So if you have a hemorrhoid, you can try pads that have witch hazel on them, which can heal and soothe hemorrhoids. Also, be sure to drink lots of water, and you can order over-the-counter hemorrhoid ointments online. Now, I will link to everything I have talked about here in the video description down below, but remember to talk to your provider about any issues that you might be having. Let's move on and talk about breastfeeding. Breastfeeding, if you choose to do so, is amazing, but it also can be painful, and even I wasn't quite prepared for it at first. So first tip, at the hospital, they have breastfeeding specialists. They're there at your disposal, so use them. If you can, have them there for the first time you try to have your baby latch on. Yes, the baby does instinctually know how to suck, but you have to help them latch properly. It will save you a lot of discomfort. But even with a properly latching baby, there are still some struggles. So let me show you what saved me in the first few weeks of breastfeeding. And that is these. Whoops. And that is these. These are Medela Tender Care Hydrogels. I didn't have this for my first baby, but my nurse gave them to me at the hospital for my second baby, and it made a huge difference for me. This video isn't sponsored by them in any way. I bought these myself. I just want to be able to share with you what really helped for me. And again, I will link to this in the video description down below. It was really helpful. But pro frugal tip, one of these honestly is just big. I mean, you just need it to cover your nipple, not, you know, like your whole breast. So I recommend cutting it in half triangularly. That helps it to go twice as far. I'm going to move on and talk about postpartum depression. Now, I will be doing a video all about just postpartum depression. I think it's an important topic. I think it needs to be talked about and it deserves its own video, but I do feel like it's important to cover it in this video as well. But being pregnant and delivering a baby is a huge hormonal change for your body. There is nothing else like it. Plus, all of the physical changes that come with being pregnant, the miracle of delivering a baby, and now having to take care of a little human being, I mean, that is a lot. So I'm glad that postpartum depression is something that's more openly spoken of now. There's nothing to be ashamed of or embarrassed about. So let's talk about that now. Now, sometimes people mix up the term just baby blues and postpartum depression is the same thing. Baby blues, which can also be called postpartum blues, is considered more mild and will go away within 2 weeks of delivering baby. You might feel more anxious, you might feel happy one minute and then are crying the next minute, and you might have a hard time concentrating. And this is pretty common. But if these symptoms were to continue for longer than 2 weeks, or your symptoms are more severe, you could be experiencing postpartum depression. On top of feeling anxious and sad, symptoms of postpartum depression include having a hard time sleeping, even if the baby is sleeping well, difficulty getting out of bed because you just have low energy, feeling guilty, feeling overwhelmed, or feeling like you can't take care of the baby. Now, if you feel that way, talk to your medical provider or your OB and let them know how you are feeling. They might want you to take a medication for this, they might want you to see a therapist, or maybe even both. Tackling postpartum depression in as many ways possible is the best way to getting you feeling better faster. Now, if you have feelings like you want to hurt yourself or your baby, you need to go to the ER where they can help you. You can also have an ambulance come pick you up if you need to. And there's also a National Suicide Prevention Lifeline, which I will link to in the video description down below. Now, as promised, I'm going to go over some symptoms that you absolutely should tell your OB or midwife about right away. There are a few life-threatening complications, so it's important to know what symptoms to watch for. If you have one of these symptoms, it doesn't mean that you have a life-threatening complication, but you do need to tell your OB so they can determine what needs to be done. So if you have a headache worse or different than your usual headaches, if you have abdominal pain and diarrhea, if you have vulvar swelling or heavy bleeding through a pad every hour or more, or if you have a fever, be sure to call your OB right away or go to the ER. If you are having chest pain, shortness of breath, or if you have a seizure, just go to the ER. You can call your doctor as well, but go to the ER. Now, this is not a full list of issues, and if you are ever concerned about any of your symptoms, talk to your own OB. And also, general note, make sure you follow up with your OB for your postpartum visit. That's where they can take a look down there and make sure everything's okay and answer any questions that you have. Also, and finally, just a reminder, this video is intended to be educational and informative. It is not intended to diagnose or treat you. So if you have any medical issues that you are concerned about, again, be sure to talk to your own OB. But if you did like this video, please give this video a thumbs up. That always means the world to me. Use the comment section down below to take the opportunity to brag about your brand new baby that I know that you adore. I love reading about your deliveries and your sweet new little babies. Also, remember to subscribe to Dianainthepink. Check out my playlist. I've got a ton of information about women's health and pregnancy. Click on any of those videos and I will see you over there.